A very good evening to everybody. Today, here we are again, some of the known faces and some of the faces which have a good fan following, bringing in maybe a similar topic which you have heard several times now, or the word which has been echoing in our meetings, in our discussions, or something that's coming up in the chat groups. So today, again, we are bringing in the thoughts of telemedicine to all of you. And why telemedicine again and again? And again, bringing in this. Because you see, the future and present is changing. The present is transition between the pre-COVID, post-COVID, or whatever. However, telemedicine existed for years. The only thing is the concepts are coming new to our mind. We are understanding this and taking it in terms of optometry also, knowing about it, and how optometry can fit into telemedicine is something which optometry has to learn. It has to learn how this works with ophthalmologists and how we can take the patient care beyond this. So if we just look into the present times, how many of us are ready to go out for a health checkup to a hospital, even if we have small problem now? The best is avoid it. So if our elders in the family have said that, yes, I'm not feeling well, the first is self-medicate, drink in your kawas or adrak or dalchini or whatever, try to cure yourself and avoid going into the hospital. So the time may be something like this. The eye doctor was an issue. And if we look at remote areas, the challenge in the remote areas is much more. The remote people, because all the barrier studies, if you go through, are typically talking about availability, transport, and many things. So are we looking at solutions through these telemedicines? So are we really wanting to know how optometry fits into this telemedicine along with ophthalmology? There are many questions in my mind. In fact, many of you would not have even known or want to know what this telemedicine. We've heard about it. It sounds easy. Telephone, medicine, practicing or consulting. But is that really what telemedicine means? Or is it what we have to understand? So today we have a panel, again, both optometry and ophthalmology experts sitting with us, again and again bringing you the same time, coming forward, spending their time to educate you, to live in this present and future. Please try to change yourself. Please try to learn today from them. And we are privileged that they have it's an honor for us that they have it's an honor for us that they have agreed to come onto this platform to again and again share their insights to whatever best is available to us. So the introduction about Mr. Ajit Bhardwaj, we all know him as an optometrist. I know him as an optometrist, a senior from AIMS. When we both graduated, I entered and he graduated out. He moved and did his master's later. He's running an optic center and his son is also looking after it. So his second generation has gone into it. But after his second generation has gone into it, he's thinking of new ideas and innovations. One such was also very unique, which he brought in. And he's a tennis player. We all know he represents the nation and he's brought in many pride moments for us. So we welcome Mr. Ajit Bhardwaj and we appreciate the content of telemedicine handbook that he has also brought in. And the next person whom I'm introducing is Dr. Rashmin Gandhi. He's a favorite fanfare, and I know the moment the message flashes out, it starts circulating, knowing there's something new which is going to come in from Dr. Rashmin Gandhi, and his way of presentation is also good. So he's the managing director of Beyond Eye Care and Healthcare Private Limited, and that name itself means that he's going to talk beyond eye care and healthcare to us. He's also a neuro-ophthalmologist consultant director, Center for Sight Hyderabad and Datta Meghe Institute of Medical Sciences. He's been the founding member and vice president of the Indian Neuro-ophthalmological Society. And in addition, he is a visiting professor at the University of Edinburgh. He's also a consultant of Hyderabad education. He has undergone the training in John Hopkins Neuro-ophthalmology, and I know many of us are scared about neuro-ophthalmology. And the last session which he did for all of us, he made even a torch exam and pupil exams so simple that the scare of neuro-ophthalmology is going to go off after it. So without talking or taking much time, I'm going to be sitting at the student end and listening on to these experts to what can be coming into it. So over to you first, Dr. Rashmin Gandhi. Thank you.
Thank you so much, Dr. Monica, and I would like to profoundly thank Mr. Ajit for actually having this session and inviting me, because this is, as Dr. Monica mentioned, it is extremely important. And it is always said that if you change with the times, then you'll never be a failure. But if you forget to diagnose what is changing around you and don't keep pace with it, then you'll find that the others have moved forward and you are lagging behind. And we are at the cusp of such change, which is happening very rapidly. The changes happen, and generally they happen, they take time, and we have time to cope up with it. But because of this extremely extraordinary situation of COVID infection, the healthcare technology and changes are happening at a very rapid pace. The way patients are, and Dr. Monica mentioned it very nicely, that the way patients are looking at eye care and healthcare is now different since March. The way hospitals are looking at eye care and healthcare is different from March. And the way healthcare technology companies are looking at eye care is different from March. And we all, as individuals or part of this ecosystem, have to understand what's happening and keep pace with it. Now, just to give you a simple example, in Chennai, in Shankar Netralaya, we started Teleophthalmology way back many years ago. And I remember those days, there was the internet connection was a rarity. It was not so easily available to all of us. So we in fact used to have a satellite dish through which we'll connect the patient to the consultant who was sitting in the hospital. But that thing is completely changed now. So the technology has become much more accessible to all of us to practice teleophthalmology and design our business models around teleophthalmology to make sure that we serve our patients, and also we make sure that our businesses and our enterprises run smoothly. So what exactly is teleophthalmology? Teleophthalmology is where in most instances either patient is not physically present with you, so you are examining patient at a remote location. And then the second part, as it happens a lot of times, that if it's beyond the scope of your area of interest or scope of your expertise, then you need to have somebody else help you out to deal with that patient. And so even that second part, where the expert also is not with you, patient is either with you or patient is not with you, and you can connect all these, make sure that patient is served, and whatever patient's problem, most of it can be solved without really having too much of a travel. And it is extremely important, and as Dr. Monica highlighted, that a lot of patients, even for an issue which may be painful, are not, I just had last week a patient who had a third nerve palsy. So patient had diplopia, but he was in an age group where he was a little scared to visit the hospital. So he was very clear saying that I would not be able to come to the hospital. Can you help me remotely? And this is just one example. And there are a lot of these patients who would not like to visit a doctor or a hospital because of the serious problem that they may face because of the infection. The infection is really widely prevalent. So that's where I think optometrist, optometry as a professional, optometrist as a professional is best suited to exploit this whole scenario. Reason is patient may still would like to go to an optometry professional or his practice because he knows that the patients who are going to visit him, the optometrists, are not likely to be the patient who have a serious problem. And so likelihood of an infected environment is much more in a hospital than in a clinic. And if the clinic proclaims all the social distancing norms, then a patient will be very comfortable to visit you, number one. Number two, if he just wants to consult you, he can just call you, tell you what the problems are, enumerate the problems, and just by a phone call, there is a possibility that you'll be able to solve his problem or at least guide him. And there are now major business models which are revolving only around these concepts, that there is a physical distancing. Uh, Patients are not with you. How do you make sure that you still exercise your profession and earn out of it? So I would like to, and I, Dr. Monica and Mr. Ajit have been discussing about this for a very long time. And Mr. Ajit has already brought out a lovely, lovely document, very well thought document. So we already have the guideline and the principles. The question is, how do we implement it in a practice? So there are, and I'll also tell you why this is important, because there are major hospitals and institutions who have recognized this, that a teleophthalmology is probably a way forward. They have realized that patients are not going to come to them, so they are going to the patient. And there are hospitals and big institutions in eye care who are tying up with optical chains and the optometrists to make sure that a synergy between what a hospital and institution wants to do and what an optometrist can offer, because optometrists are going to be always going to be the first line of contact with a large number of patients. So since a lot of people are already going into this, that is the other reason why we should always look at it seriously and see whether we can implement it. And as I mentioned earlier, it is now easier to implement it than it was, let's say, 15 years ago, because of lack of good internet connection. So what does it entail? It generally entails there are two scenarios where patients are with you and patients are demanding a further investigation or treatment without really need to go to a doctor. So this is where you can have a set of people you get connected to, ophthalmologists, experts, who can remotely guide you. And mind you, now after this coronavirus pandemic, it has become legal. Government has come up with the guidelines where it has become legal to have a teleconsultation or even have a prescription on a teleophthalmology consultation. It was not legal last year. So you can have a patient who you can serve while patient is sitting in your clinic. And most of the problems, the medical problems, can be taken care of just by having a teleconsultation with ophthalmologists with whom you have a tie-up. The second possibility, and we had a practical demonstration of it 2-3 weeks ago with Mr. Ajit, where patient was sitting in Delhi and he and his son were talking to the patient, and I was in Hyderabad, and we all closed the loop to serve the patient and to make sure that patient is doing well. So patient is not with you, but he is in your area, he's connected with you, he knows you. And one way of building this is to advertise everywhere that you are open for a teleconsultation. Give your number or give your, and I'll also show you as to how it can be done. And patient then connects it with you on a platform which you choose, and from there you determine whether the patient needs to visit you, or you can take care of the patient just by a teleconsultation, and also connect your ophthalmologist to the patient to say whether any further treatment or any further help that patient requires. So how do we achieve it? Simple way, one would say that, why just make a WhatsApp call, or why don't we have a video call? The problem with this is that it's very difficult to build a business model around a simple WhatsApp call. So there are platforms which are available. Again, these platforms have gone through a good evolution. There are platforms where you have to download an app, and we are discussing, and we have developed a platform now where you don't have to develop anything, just download anything. You have an internet connection, go to Google Chrome, you enter some details on a platform, and that's it. You can connect either to the patient or to a doctor just on a platform, and it's a seamless video call. And this platform allows you to actually magnify the patient's eye. So patient is on a call, you can magnify it manually on your video to say whether patient has a problem or not. So one way of connecting is to have a platform, and the importance of these platforms are these platforms come with a payment gateway. So if you're consulting with a patient can pay you for your expertise before you start helping the patient. And that obviously is a very important thing to consider in the present era, because the money has to circulate and your enterprise has to survive. So a platform is important. And as I said, a lot of platforms are available. And I, with the doyens of optometry, have already designed a platform, and we'll talk about it when it's completely. I'll probably be able to show you some part of it on a screenshot now. The other important area is once you have talked to the patient, can you go a step further and find out what patient is actually having? Because as an optometry professional, after making sure that the refractive part and optical part is taken care of, can you also determine, looking at the patient, whether patient really requires a further investigation in the hospital or just a phone call is sufficient? And for that, a lot of AI-based platforms are being developed. I have developed one on neuro-ophthalmology, where a patient has a loss of vision. Then you just have 10 or 12 details, simple details which you have taken in a history, whether the patient is male or female, what is the age of the patient, whether the patient has diabetes, hypertension, or cholesterol problem, how did the vision go down. And just by answering those 10, 12 questions on a click of a button, the AI will determine whether the patient has an optic nerve problem, if it's optic nerve problem, if it's optic neuritis, ischemic optic neuropathy, whether it's some sort of raised intracranial pressure. And it will also tell you that, yeah, this is an emergency, patient should go to hospital, or, okay, this is a problem where you can just call an ophthalmologist and we'll be able to help you with a further investigation, patient require further investigation. So these are the kind of platforms which will enable you to make sure that we serve our patients better. Patients' apprehension of visiting too many places is taken care of, and at the same time, you are able to build a business model around it. Let me just show you an example. If I'm able to share a screen, I'll be able to show you as to what I'm talking about. So you see here, this is a platform where you just go to Google, and this is an example of platform that I have developed, where you just write your email and password. And if you're not if you're not registered for it, then there are ways by which you can register, and you can go back and register and then use the platform. Let me show you one photograph of the AI-based. So this is the AI-based platform that I was talking about, where you see this, what is the age, whether it's male or female, what kind of locality is coming from, how the vision loss proceeded. So it also lets you know as to what questions are important in these patients with acute loss of vision. And then you make sure that once you get the report, you act on it, or there is also a built-in backup. So at every point, if you don't understand what that test is all about, you can always have a backup of an ophthalmologist who you can call or chat with to say that whether what I'm doing, whether I'm on the right pathway, if I'm missing out on something in a patient care, and how do we proceed forward. So in other words, to summarize, as has been mentioned in Mr. Ajit's document as well, teleophthalmology is here to stay. We all have to make sure that we exploit this platform. Actually, it's a very beneficial platform. We are able to reach out to many, many more people just by using the platform. And you know, even if you're not in a clinic, if you're sitting in your house, and if 8 o'clock, if patient comes in, you're still able to quickly talk to patient and make sure that he's fine or not fine. So there are advantages of teleophthalmology. We'll hear much more about it from Mr. Ajit as well. It is here to stay, and as Dr. Monica mentioned, we have to keep pace with the time to make sure that we exploit it further. I once again thank Mr. Ajit for involving me in this very important topic, and I hand over it back to you. Thank you so much. Mr. Ajit, thank you.
Oh, thank you, sir. Thank you for your wonderful presentation and insight into telehealth and teleophthalmology. And I will just take your point and put some stress on some of the issues. What you have mentioned is what is telehealth and what is telemedicine, which we have already discussed many times before. But what is the importance at this particular time and in future? See, when I look at this technology, I remember our experience with the aviation industry. So telehealth is going to change the way our aviation industry, our travel visits have changed. And if you go back, says like before 9/11 we traveled, and after 9/11, how the security at the airports were tightened, how the visitors were not allowed at the airport, and that is going to happen in the hospitals. the visitors visit to the hospitals are going to be very, very restricted, and this has already happened for a good cause. And second thing, what has happened after the 9/11 in the travel industry is the security. The way we are frisked before we travel, same security measures are going to be adopted before a patient comes into a clinic. And that security has to be from both aspects, from the patient's perspective, as well as from the hospital perspective, as well as from the healthcare perspective. That is the second change what we will see in healthcare after whether after COVID stays or not, that's something different. But how this industry will change is we will see that security arrangements of patients, security arrangements of our doctors, security arrangement of all healthcare providers are going to change post COVID-19. Third thing, what will happen is this: the way we pay. Before we had so many people in between, we had a travel agent in between where we bought exorbitant tickets, and now we were able to get cheapest. And that is what is happening already in the healthcare. We are able to get the consultations from the doctors, comparing their fees, comparing their, not necessarily the price is the main factor, but sometimes we look at how much we are paying for each consultation. Whenever we traveled, we looked at this now. Similarly, the same thing will change to the healthcare as well. So these three changes will drive healthcare. One is the restriction of patients coming to the hospital. Second is the security or the safety of patients and doctors. And third is the prices our healthcare system or our patients are going to pay. And the fourth change, what you have seen, if you notice the Uber technology, what it has changed the way we take our taxis, the way we travel within cities, that's again going to be happening in the healthcare. We are going to see similar way our healthcare providers will be available to us the way our taxi drivers are available to us. And that's not something what I'm happy about, but at the same time, this has happened in that industry, in travel industry, and that will happen in the healthcare as well. And we may not like it as a healthcare providers, but what I'm trying to tell you is that this is something which is already happening. If I don't get it, if I want to see a doctor and I don't see somebody available, I see another 10 people interested to give me the service at the same time. And if we don't change, then we are going to falter. We are going to make a mistake because the technology is here to stay, and technology is here to provide a convenient and affordable, a cheaper, a safe healthcare. So whichever industries we are in, whichever healthcare system we are in, we have to make sure that we have to be relevant in today's practice of healthcare. And why ophthalmology? Because if you notice it, ophthalmology, after radiology, dermatology, we are the best suited profession for telehealth. Why? Because we use digital images after these two healthcare professions. Our digital images like retinal images, you can see your OCT images, you can get your anterior segment pictures, you have portable slit lamp pictures available to us. You can magnify your patient's eyes. Most of the patient's symptoms can be interpreted if you are, what I mentioned even today in my post, that practice of medicine is an art of observation. If you're a good clinician, you have to develop an art of good observation. And that is what we have learned from Dr. Rashmin in past by simple torch examination, how we can identify whether it is just a simple red eye or it's a acute glaucoma or it's a uveitis or it could be scleritis or it is just a something in which the patient will get automatically fine after without seeing anyone and without consulting anyone. And this is where optometry fits in. See, ophthalmologists are too busy. They are too less. They don't have time to do all that work for a healthcare. And I can tell you, it's not something that is easy. It takes a detailed perspective from patient's perspective, from patient point of view, from his history point of view, from the protocol point of view. And either you have a dedicated team of people to work which is very again makes it very expensive. Optometrists are best suited to fill in this gap, and not only fill in the gap, because the way we can be accessible to the patients, the way we are in a position to identify, yes, this is something that is simple, and this is something that needs to be seen by an ophthalmologist tomorrow, and this is something that needs to be seen by ophthalmologist right now. Something that could be a common allergy, something that could just be just a subconjunctival hemorrhage, that's not going to give any harm to any patient. And that is, there could be something like a life-threatening red eye, which an optometrist can identify. And this is what we need to develop by our skills, by using the technology, and this is what we need to implement in our technology. You see, we have reached so far by traditional way of business, and that traditional way of business is not going to take us too far. So my suggestion and my request to all the optometrists is, I know being in a healthcare, being an optometrist for 40 years of experience, I'm very comfortable giving a patient, treating a patient, doing a patient's refraction, sitting in my clinic using my retinoscopy. But that is something that is desirable, that is something that is needed, that is something that is important. Thus, a comprehensive exam cannot be replaced. But what is more relevant today, what is needed, is more important than what is nice. Whether this is something that is comprehensive, that will give a full satisfaction to the patient, that will give a full satisfaction to the healthcare provider, is not as important as what is desirable to be done at this particular time. And I've seen that patients feel very happy when they come to know that this can wait. I've seen my own parents, they are waiting for cataract surgery. I can see that there's no urgency in it. If it was a normal situation, I would have taken to the hospital and got the surgery done. And similarly, likewise, many patients I have seen, they say, okay, sir, can I wait for 4 months for this cataract to come? And we say, yes, there's no issue on it. And if this patient has to go to the hospital and get the same opinion, he will not be happy about this. And most of the patients with chronic diseases, with diabetic retinopathy, with health conditions whereby they could be exposed to infections. You know, hospitals, yes, people, even in the earlier times, people realized that hospital is a big source of infection. Putting patients in the hospital, neither the hospital administrations like it, nor patients like it. But it is the situation where we are in, and we have to make sure that those visits, those hospitalization, I'm happy that in ophthalmology, most of the hospitalization is cut down, or practice in ophthalmology has become just an outpatient procedure, whether it is a cataract surgery or glaucoma surgery. Most of the surgeries in ophthalmology don't need the hospitalization. But that has to happen in other healthcare professions too. And I can see that trend emerging. Even we will see that in time to come, most of the companies who are manufacturing, I can see that after this COVID-19, I could see emergence of self-refracting devices which a patient could afford. You will soon see retinal cameras which a patient could afford and keep in his house. You will soon see, or IOP tonometers which a patient will buy and keep in their house. These are going to be the need of the patient, and they will be buying this and they'll be keeping them. And some of these companies are already, they have the instrument. The only thing is just that the pricing has to come down with time. And that is, if they don't bring the prices down, some other companies will do. And all these devices, whether it could be, I was very happy to see even the portable OCT, home-based OCTs are now are available in the market. So what is left? The only thing is this, that it is the will of optometrists and ophthalmologists to embrace this technology and bring it to the practice. And I'm very sure that the technologies, the people who will be able to adopt it sooner, they will be the one who will take the profession forward, who will be able to meet the need of our patients, and who will satisfy the need of our patients. I have compiled a document, and I'm sure many of you may have seen it, But if you have not seen it, please look into those details. Please look into read the document, read that read that book on telehealth, and you will understand that most of the things, most of the procedures most of the patients' need can be met by patients remotely. Our healthcare, public health, our school screening system or school screening has to change. The way we are looking after vision centers, transportation to the patient or transporting a patient to the hospital has not proved an affordable system, an affordable and convenient system of healthcare. It's too expensive for any government. It is too expensive for our people. We have to adopt the technology in our school screening, in our vision centers. I really don't understand why our government don't make it compulsory for every vision centers to have a telehealth center. What does it take? It just need a simple, only a computer with a camera, and whereby a patient can go, he can be identified. Most of our vision centers are doing what? They are only screening cataract surgery, or maximum they are only doing the prescription of glasses. And the third is the referral. And all this can be done while the healthcare provider, the optometrist, or a senior ophthalmologist, he's in the tertiary center, in the secondary center, and optometrist sitting in the district hospitals or sitting anywhere, can examine, can screen, can identify, can refer, and bring the patient for surgery without going to that village or that remote center. So we have to take this forward, and I would urge that optometrists, as Monica said, that they don't know from where to start. We'll be very happy to guide anyone. We'll be very happy to, because there are two factors. Ophthalmologists will not have time. Why will not have time? Because they are already too busy, whether they are in a private sector or in a public sector. They have too much of workload already within them. When they are too busy, even in their clinic, why will somebody will have time to wait for a telehealth consultation? Because he can call the patients, and patients are very much willing to line up. So it is the optometry who have to take up this cause and make sure that they are able to do what they can do, and they are able to screen the patients, refer the patients, connect with the ophthalmologist when he is free, and be a part of a team rather than just be sitting in isolation and just doing only refraction. Most of the optometrists are feeling very happy prescribing glasses and contact lenses. But let me tell you, those days are gone where you could make money with glasses and contact lenses. With online sale of glasses and contact lenses, your days are numbered where you will not be able to make a decent living. You will not get a decent salary if you are restricting yourself to prescription of glasses and contact lenses. And you must change. And change has to be done right now. Because if you will be too late, it will be too late for you, and it will be too late for the healthcare system. Thank you very much. And thank you, Monica, for conducting this and hosting this. And we'll be glad to answer any of your questions on this topic.
I think that's a brilliant point that you highlighted. A couple of brilliant points that it will be very soon that technology empowers not only us but even the patients to take care of a lot of their problems, and we are there as a backup to say whether this is right or wrong, or where technology is. So that is number one. Number two, I completely agree with you about the role of optometrist. Role of optometry has to be much more than what it is right now in the complete team, and it's an opportunity. I mean, we all know that optometry courses are very well designed, and all optometrists are capable of doing much more than only refraction. It's just that because, as you said, because up till now refraction was bread and butter, so the other factors took a little hit. But with Lenskart and other these platforms doing or what they are doing, we have to make sure that we utilize our talent and our subject expertise and also the technology to make sure that we continue to prosper and serve our patients.
Well, thank you, Dr. Rashmin. You know, I was reading an article on telehealth, and you see who is the biggest telehealth provider today? Can you imagine? And when I read who is the biggest telehealth provider, is Google. Where do we consult when we have a problem? Likewise, our patient also consult Google first. And patients today, there was a time when patient came to discuss their symptom. Today, they are coming to discuss whether the diagnosis or the treatment you are giving is correct or not.
Is that correct?
See, the technology is
Absolutely.
changing and the profession has to change. We can't
Absolutely.
just say, okay, you have this and you are done. Today, patient will argue and he will know more about his health conditions than what he knew earlier. So we have to be
Absolutely.
prepared and accept and put ourselves into the right gear and proceed in a way that it helps the healthcare system of the country, and both optometry, ophthalmology, and our patients and their caregivers take benefit of the system.
Absolutely.
I would
Agree
say
with you.
this has to be integrated into the curriculums, and that's where universities have to come forward. So there has to be trainers, or of course, one session can be combined for all across. We don't need to have faculty experts in all the universities, and we can have these sessions. So my question to the panel, of course, to both of you is, what is the present status? At what level is telemedicine here in India? And if we look at eye exam, is screening also an easy way to begin or enter into telemedicine? Screening of vision and simple, maybe school screening, home screening, or something. Do we look at it as the first step immediately that somebody can enter into? Second, does it need lot of training to enter into these kind of into telemedicine? So questions for either of the panelists.
So I'll take it first, and then so there are two aspects. According to me, I think the easiest way to enter the teleophthalmology space is the first step, because whatever online resources that I've seen, they're not really as of now absolutely mature to allow us to make a final decision while patient is not with us. So I think the first step is to say integrate combined model where screening from the symptoms and a, a screening from whatever vision that you are able to check by giving the online applications. Make sure that you see the patient and decide after that using these teleophthalmology tools as to whether what is required. And up till now, what we used to do is that if the vision does not improve with the refraction, we send the patient away to wherever they are supposed to go. But now with this ecosystem, you probably can play a bigger role by saying that why your refraction or pinhole, the vision is not improving, and what can be done by just sitting in your chamber, where the patient is in your chamber, whether even the third step, whether OCT is required,
I
visual
think
field is
I
required.
think that
Uh, Monica, with my experience of
on,
telemedicine,
or especially children, and kids need once in 6 months kind of eye exam, especially if it is a myopic child. And parents never want to spend time again and again, or maybe they are a little casual. So if this appointment is fixed and every 6 months there is just a kind of tele exam at home, at least they would know the child's number has increased or not before. Because I usually realize, unless the vision drops below 618, the child is not able to perceive it, and they would come back with a -1 jump already happened, in the refractive. And how is it? Maybe a year old, maybe 2-year-old. These are the kind of spectacles which a child should be at least 6 months exam. So I think in
Yeah,
children, of course, in adults also, where we can rule out whether it is a refractive error or somebody who needs a retina exam for ARMD or diabetes or something like that. But in kids, I think there is a far more role which can be looked into and worked on to screenings. So anything you would like to add, Ajit?
you see, Monica, yeah, you see, what has happened is just that there were certain good things happened during the COVID-19. One was that we got most of the patients who had digital eye strain. People were spending too much of time on the computer, and most of the problems what we saw were just that patients were too much exposed to their near work. The second thing what we see, low hanging fruit in ophthalmology is conjunctivitis or the red eye. You will, wherever you are, you will see the maximum number of patients who consultations you will see will be only for the red eyes. Third, you will see is maybe lid lesions, maybe a foreign body, maybe just a simple refractive error need. And then you will see patients with diabetes and patients with glaucoma. That will be much, much later stage. But and most of the, you said with what stage we are in, most of the hospitals, what they have adopted is a
Yeah.
system of just making patients able to deal with emergency in eye care. No one has taken it so seriously that they can replace the system. We don't want that replacement, but at least a full alternative. I have not seen any hospital in my circle whereby they have done a full vision screening of the patient. They have not done, though no one has ventured into doing any other test except talking to the patients and just maybe doing is just maybe the red eye and lid and simple counseling. But what we need to see is this, that we have to invest, we have to make sure that they are dedicated team of people in the hospitals who take this process forward. I was, Dr. Rashmin, I just will brief you about this hospital which I mentioned in my other talk. This is a new hospital which has been there in US since 2015. And this is called a Mercy Virtual Hospital. And what they do is they have only the clinicians observing all the patients sitting in different hospitals in ICU. And they have, and patients sitting in patients sitting in their own homes. What they do is instead of bringing patients, they become a third eye of patient sitting in a different hospital somewhere else. This is something which is a supplement of telemedicine called remote health monitoring. And this is something what we can see, that when you can see a patient in ICU, what procedure you can't do in general healthcare. So we have to have that will and make sure that we have that. People don't have confidence. People lack that drive to take this technology forward. But I'm sure that in time to come, people will feel that before you prescribe or before you give medication for red eye, you need to make sure that you have checked the vision, because it's not fair whether he's an ophthalmologist or optometrist to to prescribe any medications without checking the vision first. And it could be something that is very important, and I think people will just sooner or later implement those in most of the hospitals too.
It's right to say that yes, it will unfold with time, many new things, and we'll be learning it. But of course, one more thing that comes into my mind, because as I do low vision also, our major time in low vision exam is history taking, talking to this patient and understanding the needs of this patient. And now with the kind of hours that one can commit in the hospital, and you don't want these special old patients to be with you, we are actually looking at this kind of it. Can telemedicine just do the history taking at home and then bring the patient in for the exam? So we will save the hospital time also there. So there could be some people who would be trained in to take in a history, and that automatically flashes on the screen by the time patients come in for an exam. So small things, and that talking, counseling, explaining about it. So even if you have a patient with a squint and the parents want to know a lot more about it, it's the this could be even communicated through telemedicine, or pre and post sessions can be done, saving the ophthalmologist chair time. So the optometrist can take the role of it. So if I say, even if it's a graft patient or a LASIK patient needs counseling, this could be done in the optometrist can take the role of it. So if I say, even if it's a graft patient or a LASIK patient needs counseling, this could be done in the optometrist chair time. So the optometrist can take the role of it. So if I say, even if it's a graft patient or a LASIK patient needs counseling, this could be done in the optometrist chair time.
I
It's
think our connection is a little patchy.
uh, Monica, I can't hear you. I think are you?
I think now it's okay. It's gone in a mute, Dr. Monica.
Sorry, my network dropped there. So as I was saying, we were looking at research. I think there is a lot more scope of doing research into it in understanding patient perspectives and practitioners' perspective, because that will help us go to the next level. If we understand how the acceptance and into the small things that have come into the practices, I think people should be invited to get into these multi-centric researches, and that's more important now for us.
You see, for Monica, for low vision, I see another opportunity because once we are able to talk to the patients, we are also able to see his conditions where the patient is. We are able to see the surroundings. We are able to see his room where the patient is. And that gives a lot of insight into, rather it gives me more confidence that I need to see and improve the patient's condition at home. And patient has to sit in that room, and most of the patient with low vision, they are there most of the time. So it's an opportunity for us to understand.
I perfectly agree to it. So even if I have prescribed a device, the student or the child is back home in his lighting conditions, in his room, in his study table, and maybe we are actually understanding through it what can I do to him. That's perfectly fine. I think understanding real life situation is perfect through telemedicine.
And sometimes just by improving the lighting condition, improving, we can tell him, okay, remove that chair from there, remove this clutter you have in your room. You can improve so much which the patient may not even think of. So it gives an opportunity for us to observe patients in a better way. And most of the counseling in low vision, in most of the rehabilitation is can be done by telehealth, not only in ophthalmology. If you look at the exercise, psychiatry is all about counseling. Psychiatry is all, you don't see any patients, you don't see the brain, you don't see the patient's any diagnosis or any digital picture of any of the part of the brain in psychiatry, and you talk to the patients and diagnose and treat. Psychology is all based on that, and that is most of the AVT therapy, most of the stammering therapies, they are being done on the telehealth today.
No, brilliant. Both points are very, very good. First point about the history. It's already happening, and it has to be implemented in a bigger way. Is that patient participates in his own treatment. Now, as you said, in a clinic, you may have a very limited time. There are questions that you would like to ask or observe, but you may not be able to do it. But if you give him a questionnaire which he has filled up and he has sent it to you, you can include 100 questions instead of 20, and he's participating in his own treatment. And that point about LVA and his natural surrounding is just brilliant. I think why patient is not happy, whereas just not because your device is not good, but because it's not being used in his environment in the way it should be used. The subtle point which he would have missed when he underwent a counseling. Great points.
Thank you. So, Oli, would you have any question for us, or?
Yeah. So if there is anything, or we would like to.
No, I think all questions, ma'am, already bring on this platform, and then we can conclude the session.
So I think the activation of Tele, this should keep continuing, and I know there'll be repeat. People are getting into it. So some things, when new things come into the market, it's not easy for everybody to take it. Some of them would have said, "Yaar, sun liya, ho gaya. India ko bahut time lagega. Abhi bahut der hai. Abhi to bahut kahan hai." But I think there will be time when people will realize it's not too far away. We all will have to learn it. And thank you so much with both of your initiatives to continuously bringing it out. And I think we'll keep hammering people. And every time we discuss, we come with new ideas. So my low vision patient, next time I just say, आप मुझे वापस आके दिखा देना कि ये device कैसे काम कर रहा है. I don't need you. I'll just send you a Zoom link. Tell me at home ये काम कर रहा है कि नहीं, and I'm fine with it. I don't have to call those people again. I think there is a lot more perspective every time we bring in and we learn a few things. Some more question is that we can have to have understanding of the attitudes of people when we go ahead, and of course improve upon it. So thank you so much, Dr. Rashmin and Ajit ji, for bringing it again and again to the public. And I think And of course, this is a YouTube live session which is recorded, and we will love to share so that many more people can take advantage of it. Thank you. And the thanks doesn't end up without Ollie being here with us. Without him, we wouldn't have done it. So Dr. Rashmin, you wanted to say something?
No. I want to say thank you so much. It was a great session. And I'm sure there are lots of ramifications will come out of it as we go along.
Thank you, sir.
Yeah, thank you. Good day.
Thank you.
Bye-bye.